My Lords, as a neuroscientist, I welcomed consideration of mental health in the gracious speech, and I declare an interest as the founder of a biotech, NeuroBio, working towards an effective treatment for Alzheimer's disease. However, it was in this capacity I was sadly disappointed that no mention was made for addressing the urgent issues relating to such a devastating health problem. This debate is taking place during Dementia Action Week, so it's an especially pertinent time to highlight the needs of people living with this condition. Alzheimer's is a neurological disease characterized by memory loss, disorientation, and general cognitive impairment. It presents typically, though not exclusively, in older people. 1 in 6 over the age of 80, and as many as 70% of residents in care homes. The spectre of Alzheimer's is one of the cruelest potential scenarios awaiting us in later life. Whilst heart disease and cancer are serious, often disabling, and sometimes terminal, you can still reminisce over old photographs, still spend meaningful and precious time with your grandchildren. These life-enhancing moments are gradually closed off to an individual with dementia. There are currently around 900,000 individuals living in the UK with dementia, a figure projected to rise to 1.6 million by 2040. The cost of care in the UK is currently £34.7 billion, and this is set to rise sharply over the next 2 decades to £94 billion by 2040. Many noble lords have already spoken on the issue of carers, and I think that this is particularly important with respect to Alzheimer's. Imagine the impact for Alzheimer's on the family, specifically the financial and mental health repercussions of giving up a job to care for a loved one, perhaps the love of your life, who then no longer even recognises you. A scenario on more than one occasion I've heard of as a living death. I think there are 2 other main issues that could have been addressed in the gracious speech and were omitted. One is the issue of obtaining a diagnosis. The reaffirmed commitment to invest £2.3 billion to increase diagnostic activity with ambitions to roll out up to 160 community diagnostic centres is obviously to be welcomed. However, this must include a commitment to specifically improving dementia diagnosis. These are currently at a 5-year low, with over 30,000 additional people now living in England not formally diagnosed. The Alzheimer's Society estimates it would take 4 years to clear the current backlog without extra help. There are national strategies to deal with the backlog in elective care, in cancer diagnosis, but nothing to fund or plans to deal with this specific backlog for Alzheimer's. It will not go away on its own. Memory assessment services are vastly overstretched due to the pandemic, and this is largely caused by workforce pressures. Individuals are being referred into services, but the services cannot deal with the referrals at the same rate. And memory services are seeing people come to them with much more advanced symptoms than previously. Just £17 million, my lords, would allow the NHS to address the backlog in secondary care while making allowance for increasing primary care costs. Up to 65% of emergency hospital admissions for people living with dementia could be avoided if they had the right support. The individual patient could then become more actively involved in personal decisions, including healthcare. They could use treatments more effectively, focus on what's important and make empowering choices. They could take advantage of resources and help advance research, perhaps by joining clinical trials. With over 150 such programs worldwide currently examining potential dementia treatments, it is more pressing than ever that we can identify suitable participants. This brings us to the third issue, one of research and the development of new drugs. The government needs to deliver on its manifesto commitment and fund the dementia moonshot as soon as possible. As a scientist myself on the front line of research, I was saddened to see no mention in the gracious speech, but such funding is urgently needed to deliver on our ambitions for dementia research, crucially delivering new treatments. In parallel to increased research funding, the forthcoming National Dementia Strategy must set out a bold and ambitious approach from government to create new momentum and help push us over the finish line to the first wave of new treatments. For example, Alzheimer's Research UK are leading calls for the government to apply lessons learned from COVID-19 vaccine task force by establishing a dementia medicines task force. The task force would act as a catalyst to accelerate the development of new treatments. It would harness existing strengths and leading initiatives in the UK, minimising gaps and tackling any duplication in current approaches. The goal would be to ensure new treatments reach those who need them as soon as possible, It would drive progress in research and speed up clinical trials as set out in the Dementia Moonshot Manifesto. And this would ultimately benefit current patients while also creating a powerful global offering for global life science investment. My lords, any one of us here could succumb to Alzheimer's, and a significant number of us are likely to do so. It is one of the biggest health challenges we've faced, and as such it cannot, as it was in the gracious speech, be ignored. Yeah.